Hi everyone, have you heard about Neuroprotective Bundle? This bundle is designed for babies born less than 32 weeks or birth weight less than 1500 grams. The aim is to prevent intraventricular hemorrhage in these preterm babies. The bundle should be applied within the first 72 hours after birth. This approach will help to reduce venous congestion in the brain and ensures normal blood flow and ultimately prevent intraventricular hemorrhage in these preterm babies. Germinal matrix hemorrhage or intraventricular hemorrhage can be classified into four. In grade 1 intraventricular hemorrhage confined to germinal matrix, in which bleeding is limited to the germinal matrix and no blood inside the ventricles. In grade 2 intraventricular hemorrhage, intraventricular extension involving less than 50% of its volume, in which blood enters the ventricles, involves less than 50% and ventricle are not enlarged in this case. In grade 3 IVH, intraventricular extension involving more than 50% of its volume or extension into dilated ventricles, in which the blood fills more than 50% of the ventricles, causes ventricular dilation. In grade 4, this is the most severe form of intraventricular hemorrhage, in which the bleeding spread into the brain tissue, causes venous infraction or brain tissue damage. 5 specific recommendations to prevent IVH in preterm babies. The first recommendation is elevation of the head of the bed between 15 to 30 degrees. So the gravity helps blood drain out of the brain properly. The second recommendation is keep the head straight or midline position. Baby's nose should be in a straight line with baby's belly button. We can use lock rolling techniques. That means turning the whole body once. Turning the neck only to one side can cause blocking jugular vein that result in trapping the blood in the brain. The third recommendation is avoidance of the head down positioning and elevation of the legs during nappy change. Do not lift baby's leg high into the air during nappy change. Instead, slide the nappy in from the side. Lifting the legs rushes blood back into the heart and brain fast. The fourth recommendation is slow arterial or intravenous flushing and slow arterial blood withdrawal. Fast changes in the pressure can cause rapid blood flow that result in a rupture of the tiny blood vessels in the brain. The fifth recommendation is use of the IVH risk calculator. This helps to identify babies at higher risk so that we can give extra protection to those babies. Thank you.